Hello and welcome to another episode of the podcast. So, on this episode, I want to talk about irregular bleeding in perimenopause. When should you be concerned? When is it a problem? When do you not have to worry? So, let's dive on into this particular topic. All right. So, remember, perimenopause can last quite a long time. It can last up to 10 plus years. So you might start to notice symptoms in your mid to late 30s, okay? And this could go on for quite some time. Maybe you won't. Maybe you won't notice any symptoms till your late 40s, right? So everybody is completely different. But one of the symptoms that you may start to notice is inconsistent, irregular, random bleeding. Maybe you notice that your periods are coming quicker, maybe they're coming less, maybe they're lighter, maybe they're heavier, maybe you're getting spotting, maybe you're bleeding after sex. So there's a few things that you want to consider. So first of all, we're going to talk about heavy bleeding in perimenopause. So oftentimes heavy bleeding or even irregular bleeding can be due to this imbalance that starts to occur between estrogen and progesterone. Oftentimes, what's going to happen is progesterone is going to start to decrease, and sometimes this will happen before estrogen for some women. And you'll get this imbalance between estrogen and progesterone. Now, this doesn't mean that you absolutely automatically have got high estrogen, okay? The term estrogen dominance is talked about in the online wellness space, in the hormone space. And that is what we're seeing here when we've got an imbalance of estrogen to progesterone that might be causing heavy periods. It's because we've got more estrogen that is not balanced correctly with progesterone. It doesn't mean you've got high estrogen. You may not. You just stop balancing it with its BFF, progesterone. So estrogen is stimulating, estrogen will grow the endometrial lining, and progesterone will come in and will buffer those stimulating effects of estrogen. So you really have to balance the two, and it can be a little bit of a dance, right? But the reason why this can happen in perimenopause and flooding can occur, really heavy periods can occur, is because oftentimes that progesterone is the first one to take a nosedive, because you're going to have this stop-start intermittent ovulation, meaning that the progesterone is not going to be as robust as it used to be when you were having regular ovulation, because ovulation is one of the ways that we make progesterone. So as you start to get this stop-start ovulation, then your progesterone levels are going to decline. And then you might see these heavy periods because it's leading to that thicker uterine lining, because that estrogen's growth effects are not balanced by progesterone's calming effects, right? Progesterone really keeps estrogen in check, keeps that growth in control. Now, it's not just this estrogen dominant picture that can lead to irregular bleeding in perimenopause. You could have some low estrogen that is leading to some bleeding issues. You know, if you don't have enough robust amount of estrogen, then that uterine lining can actually become quite fragile, and it's not able to build up. And when it becomes fragile like that, you might notice that you've got more of this intermittent bleeding, this irregular bleeding, or you might actually end up having some lighter periods, right? You might not have the heavy periods. You might have the light periods. And what you're wondering why, what's going on? Is it cause for concern? Well, no, it's probably just because you have less estrogen on board, or you've got lower estrogen, or maybe what's occurred if you're doing HRT. Maybe you're just using progesterone, and that progesterone has really countered estrogen stimulating effects so much that your periods have become much lighter. And, you know, progesterone is one of the most wonderful natural treatments for heavy periods in perimenopause or flooding in perimenopause. You bring on board some natural progesterone, and it really helps and does wonders to calm down that heavy bleeding. You know, you don't want to be running out to get a hysterectomy if you've got heavy periods. There are answers, there are solutions, and you might also want to be considering your thyroid as well. Thyroid definitely can start to go a little skewy in midlife, in perimenopause. One of those reasons why is because progesterone starts to decline, and our thyroid loves progesterone. And so if you have a hypothyroid state, if you're in a hypothyroid state, or you have a sluggish thyroid, that might also be contributing to some heavy periods. These are all just options and considerations. Okay, so Another reason you might have irregular, random, strange bleeding in midlife perimenopause is because of these fluctuations that we're having of our FSH, follicle stimulating hormone, and luteinizing hormone. So, follicle stimulating hormone is trying to get those ovaries to come back online, and luteinizing hormones trying to get that ovulation started. So, the brain's sort of screaming out with these hormones whilst the ovaries are slowly but surely going offline. So you're going to get these random fluctuations of FSH and LH, and that definitely can contribute to unpredictable cycles, irregular bleeding, and it's normal, right? And it is frustrating. It definitely can be frustrating when you don't know when your period is coming. If you've got spotting, it can be frustrating, but it's not usually cause for concern. So, some women don't go through this, but some women do. And there's no way to really know what's going to happen for you. I mean, talk to your mum, see how she went through perimenopause, when she went through menopause. That's a great predictor. But, uh, unfortunately, this is part of perimenopause for some women is the irregular bleeding, the stop-start bleeding. And, when you bring on board, say, progesterone HRT, let's say you've been having a period every 2 weeks, or let's say your cycles are becoming really, really short. Sometimes bringing progesterone on board can elongate the cycle or regulate the cycle. So, that can sometimes help. So, talk to your provider about that. Okay, so what are some other causes of irregular bleeding? So there's definitely times when the bleeding could be coming from something else. So we might be looking at fibroids. This is certainly a time when fibroids can grow. Now, you can sometimes shrink fibroids, sometimes you can't. But the things you really need to think about if you're a fibroid girl is you want to think about your progesterone and iodine. Okay, iodine is imperative. I think iodine is vastly underused, but iodine really helps keep estrogen behaving nicely, just like progesterone does as well. It's not that estrogen's bad. It's not that we have to fear estrogen, not at all. But you do need to balance everything out and consider all the possible options. I mean, you can take on board too much progesterone, right? You very much could use too much progesterone, and then you might find that you have higher progesterone symptoms. Maybe you get really, really groggy. Maybe you get really, really depressed. Or maybe you mitigate that estrogen so much that now you're actually getting some symptoms from having an imbalance of estrogen to progesterone the other way around, a progesterone dominance picture. So I do think you have to be very cautious. And I know there's a lot of chitter chatter out there in the online HRT space. And I bring on a lot of people onto my podcast, into my community. And some of these people have very different ideas about HRT. But I think it's very important to keep the conversations flowing and happening and keep your ear to the ground. And whenever there's new research, I will bring that to you. But you need to sort of work with your provider and come up with a plan that suits you. But be mindful of what the symptoms are of high progesterone, of high estrogen, of the imbalance of progesterone to estrogen. It's important to keep those things in mind. So fibroids definitely could be a problem. So these are non-cancerous growths in the uterine muscle, and they can lead to heavy bleeding. They can lead to spotting, and they can also lead to post-sex bleeding. So that is something that you may want to get checked out. You can talk to your provider. You can get an ultrasound just to check out to see if there are any fibroids going on. And if so, you really want to be thinking about that progesterone and really want to be thinking about that iodine and the progesterone to estrogen balance. Then you could have some endometrial polyps. So these are small growths on the uterine lining, and they can also cause the irregular bleeding or the post-sex bleeding. Adenomyosis, endometriosis, again, we always come back to that estrogen to progesterone ratio, iodine. So both of these can cause painful, heavy periods. Endometriosis, very much pain is a hallmark symptom of endo, heavy periods, pain. If you've got really painful periods, you want to check out and see if endo might be going on for you. Hypothyroidism, as I said before, that can certainly lead to heavier periods in midlife and perimenopause. Very common hypothyroidism in midlife and perimenopause. And of course, PCOS. That can lead to irregular cycles, long cycles, missed cycles. So, should you be concerned? Well, you need to be working with a doctor. So I think it's very, very important to have a good doctor on your team. And your doctor doesn't have to be absolutely perfect and know everything, but you need to have a health team. So whether that be a nutritionist or a naturopath or a functional health coach like myself, plus a doctor, but I do believe you need to have a doctor on your team, somebody who knows how to run the various scans, the various tests that you might need, somebody who can come at your case from a doctor's viewpoint, which is very valuable and very important. So talk to your doctor. You want to track your cycle. That's very important because you want to track your symptoms, track your cycle, because how are you going to know what's normal for you if you're not tracking things? And then you want to be doing blood work. So you might be able to determine a few things in blood. Let's say your periods get really, really heavy. Well, you can determine if something's going on with your thyroid. And if you're working with somebody who understands symptomatology, because you're not numbers on a piece of paper, that's important too. Because if your thyroid labs look pretty good, even from a functional optimal range, they look pretty good, but yet you're constipated, you're losing your hair, you're fatigued, or you have other symptoms of hypothyroidism, then just because your numbers look good doesn't mean that your thyroid is humming along really, really well. So look at the bloods, look at your symptoms, start to track your cycles, track your symptoms, work with a doctor, work with a health practitioner who understands hormones and can really help to determine if there might be something else at play that needs to be looked into. And so, what would those things be? So, not to scare anybody, but I think it's very important just to be aware, right? Irregular bleeding is common in perimenopause. It's very, very common. And the likelihood of it being something more serious is probably quite slim. But think about your family history and your own history and what your own health might say about where you're at this stage in life. But we want to rule out things like endometrial hyperplasia, right? So this is a precancerous condition, and it is again, if we've got that unopposed estrogen, remember it's stimulating, it makes things grow. You got to balance it with that progesterone. And this is one of the reasons why we never suggest to a woman who has her uterus, we would never suggest that she uses estrogen without progesterone. Now, quite frankly, you never use estrogen without progesterone, regardless of whether you have a uterus or not, because progesterone has breast benefits, bone benefits, brain benefits. Progesterone is vitally, vitally important for overall health and well-being. So regardless of whether you have a uterus, you need that progesterone. But that's one of the reasons why you might hear from your doctor or whoever, you can take estrogen if you don't have a uterus. I don't agree with that at all. You absolutely know you're not going to get endometrial hyperplasia, but you're going to miss out on all the incredible benefits of progesterone. And I do believe you still need that balance of the estrogen to progesterone throughout the body. So of course, irregular bleeding, we sometimes have to think of endometrial cancer. This is oftentimes occurring postmenopausally. Um, Again, not to scare you, but you got to be aware of these things and chat to your doctor, and your doctor is going to guide you in the right way. You might want to get a transvaginal ultrasound done. I think that it's very important to check if you're on HRT. I do think once a year, it's important to do these transvaginal ultrasounds to make sure that you have that balance correct between your estrogen and your progesterone. And checking that endometrium and checking that it is at a safe level. I think that's very important, just as one of those little checks and balances that you do, like you do your PAP, like you do your breast checks, like you go to the dentist, etc. It's one of those checks and balances when you're on HRT. You just want to make sure. And of course, there's other things we could be thinking about too. Cervical cancer, ovarian cancer, very, very uncommon. Very sorry, not uncommon necessarily, but it's rare that this is going to be the cause of your issues. If all of a sudden you're starting to notice all these different symptoms pop up that are related to perimenopause, and irregular bleeding is something that you're noticing, it's probably perimenopause. So please do not be concerned. But again, always good to know and always important to be working with a doctor. I think a doctor is an important part of your medical team. I'm actually surprised by how many women I work with who do not have a doctor. And I always encourage them, get one. And a lot of the times they'll say, well, I can't, it's too hard, there's none available, there's I don't agree with any of that. In fact, we had a coaching call recently inside the Perimenopause Solution, and a lady was saying how difficult it is to get a doctor. But I actually said, I don't agree. I don't agree that it's difficult. And you can't have that mindset because you need one. You need somebody on your medical team. If you're listening to this podcast, if you're in my community, then we're here because we want to have not just a long lifespan, but we want to have a long health span. You require a doctor for that. And if it takes you a year to find a good doctor, who cares? Because hopefully you've got another, you know, 20, 30, 40, however old you are, 50 years on this earth. So take the year, find the doctor, have a spreadsheet. And I actually said to this lovely lady, I said, do you have a spreadsheet of doctors you've contacted? She giggled and she said, no, I don't have a spreadsheet. I said, exactly. So you cannot say it's hard to find one. There are wonderful doctors all around the world. There's doctors who do telemedicine. I work with women in Australia, New Zealand, the UK, Europe, America, Canada. Trust me, it's possible in all those countries to find a good doctor. And again, they don't need to know everything about everything. You can also have somebody like myself on your health team who runs the stool testing, who understands deep, extensive gut work, who runs the HTMA tests, who can really optimize your nutrition, your blood sugar, talk to you about your lifestyle, your weight-bearing exercise, etc. But that doctor is there for the doctory things. Okay, so you really do want to have a doctor. Um, okay, so you want to also think about if you're on HRT and you've been only doing progesterone. I think, my opinion at this point in time is that that's not a bad thing. I know that there are doctors out there who say, no, you always need to include estrogen. I think you can take progesterone without estrogen, especially in the early stages of perimenopause, when your progesterone may be okay, but your progesterone is starting to dip. So I do think that that is fine, but there will come a time when you need to be prepared and aware of your symptoms so that you know when to bring in that estrogen. Because if you take progesterone long term and you're not using it with estrogen, then this can thin that uterine lining and that could end up leading to no periods, right? So you just got to be aware of what might be causing what for you. Okay. Um, okay. So hopefully that's helped clear things up. It could just be completely normal. It probably usually is. Maybe it's a signal that you need to bring on some progesterone, right? Maybe that progesterone will help even out the cycles a little bit. Maybe if it's a sign that you're using too much progesterone. If you've started the progesterone, you're not getting a cycle. Maybe you want to consider if you're using too much or if you need to bring on estrogen to bring back that cycle, or maybe it's that you need to take a little break from the progesterone. Maybe you want to cycle it more. There's a lot of different things to consider about irregular bleeding. If it's heavy bleeding, like I said, you want to check off hypothyroidism. And if you check that off and you work on that, and your periods are still heavy, you want to think about low progesterone. And if you bring progesterone on and your periods are still heavy, it's not thyroid, it's not progesterone, then you might want to think, okay, is it a fibroid? Is it a polyp or something like that? That's when you go and do the further investigation. But yeah, I hope that that was helpful. And if you do want our assistance inside the perimenopause solution, then just head to the show notes, have a look in the show notes, and you will find all the information for the perimenopause solution in there. Another way to work with me, you're not really going to be working with me in this way, but you can book in for a 30-minute consultation with me. And again, this will be in the show notes. This is just a way that I started this up not too long ago to offer women a chance for a second set of eyes across their case. If you want me to take a little look at your blood work, take a look at some of the functional testing that you've had done. I can't develop a protocol for you. You're not a client of mine. When you come and sign up for these 30-minute consults, you're not my client. So I don't know enough about you. I need to have a client relationship with you, and I need to talk to you a lot and ask you a ton of questions to be able to formulate a protocol. But I can do a brief overview of your testing that you've had done, your blood work that you've had done. We can have a chit chat about what you're doing, what you're feeling, what your symptoms are, and I can guide you and I can tell you my thoughts and what the best next steps are for you. So that's available too in the show notes. You can go and book in with me there. And as always, please share this out with any of the women in your life who you think will benefit. Subscribe to the podcast. If you're listening on YouTube, head on over to the link and subscribe to the podcast because I don't always post videos on YouTube for the podcast. and I will speak to you again soon. Bye for now.
I am not a medical professional, and the information provided in this podcast is for informational and entertainment purposes only. I do not have access to your individual medical history or circumstances, so the content discussed here should not be considered as medical advice. Before making any changes to your diet, lifestyle, or considering the use of supplements, please consult with a qualified healthcare professional or your doctor to ensure it's safe and appropriate for your specific situation. Any decisions you make based on the content of this podcast are at your own discretion and risk. Thank you for tuning in.